Mr. Chairman, board members, thank you for the opportunity to provide some context of what's gone on over the past 15 days at the Harbor Suites. I do want to start with echoing what the chairman and all of you, the board, and what Bob just outlined. Lines of communication and getting reliable information has been challenging at best. You've all struggled with it, certainly at the health department. Our motto, if we can predict it, we can prevent it, or at least react to it. It's been very difficult to get information so that we can properly respond and protect, right? Our mission is to safeguard the community, surveillance, and hopefully act proactively. In this case, we haven't really. We've been reactive, and that really isn't the best way for public health. But it's working now, and I'd like to step you through a little bit of this because channels have been made. We have, through Bob's efforts, certainly daily, quite frankly, communications are happening. We now have, although it's not perfect data and it's certainly not timely, but we have information now with the regional director of housing and livable communities. The regional director has now provides us information. I received an email again today, as best they can. Public health, local public health is giving us information, again, as best they can, and when it shows up on their dashboard, they send us information. There was a day when this started, within an hour, Bob had information, and I had two contradictory information, so the struggles that I hope the community understands that, the struggles that this board and the town administrator has as far as unreliable, imperfect data, those are real, but we're doing the best we can with that and responding. So to walk you through this, again, Bob said 22 families, 78 individuals, but on that Sunday night when it started, I think it was the 10th, Monday we gathered all to try to coordinate and what this was going to look like, and by Tuesday, the building commissioner and myself visited the site. At that time, it was not those numbers. It was first phase, early on. I don't recall exactly what the numbers were, but it is incrementally upwardly adjusted. We were met by two RNs. The medical response team was actually on site, and that was talked about 2 weeks ago, that the concern was communicable disease. What are the concerns? Things of that nature. I hope this message is reassuring to some degree to the community and the public at large, for the individuals living there and the surveillance that safeguards for the community at large and the schools. Two RNs have been there to do medical assessments, not invasive procedures, but medical assessments, cataloging the health of all of the individuals, from the small children all the way through to the adults. That went on. Additionally, on that Tuesday when the building commissioner and I were there, four staff from DY school were there. They were doing the processing and the enrolling of school-age children. That went on for several days, and I think that probably would have continued beyond that. Additionally, we looked at the site itself. The building commissioner was looking at the pool area. That has been drained and it's under renovations, making sure that is safe. We have young children and individuals not familiar with that site, making sure that that was closed off and there weren't going to be any sets of construction site, making sure that was properly sealed. I additionally had a concern as far as the dumpster area, and I know that has been a concern. Now we have additional individuals, and the census there has gone up. They have upwardly adjusted the dumping for their trash disposal, making sure there's no harborage for vermin and rat infestations, things of that nature. That is actually quite common on the Cape, so they had to be aware of that. The medical assessments continued all the way through. And I checked, and I keep checking daily with what, as you probably are aware, the MAVEN system, right? That's our communicable disease tracking, right? The Massachusetts Virtual Epidemiological Network. That's going to tell us across all of the communities here, right? That's an integrated system of the 80 communicable diseases. There are none at this site right now. There is nothing that has, now we do have communicable diseases, don't get me wrong, in Yarmouth, and all of the communities have them. There is nothing coming from that site that has been reported. This is reported through primary care physicians, urgent care emergency rooms and hospitals, reportable diseases, right? A vast majority are influenza in Yarmouth, but there are others, and we have, we do track, and it was at the last meeting, they talked about TB. There have been TB cases in here, and we do direct observation therapy through a vendor. All that surveillance is in place, and that has been a proven surveillance and safeguard for the community, and it's happened well before the migrants coming here to Yarmouth. And I guess I would also say there are 80 communities involved in this program. 1/4 of the communities in Massachusetts are involved in the migrant relocation program. I have to, and I'm going to continue on as far as this site is being handled very well, and it's a compliment to the nonprofits and the faith-based organizations in this community, because they have taken a tremendous load off of this municipality. All of the social service, the wraparound services that we're not providing those. I'm on daily, or actually probably every other day, with the 15 communities across the Cape and beyond. Many communities are doing social work. They're actually functioning as social workers. We haven't had to do that. I've gone back. I go back probably every 2 to 3 days, and I've watched the numbers go up. We're making sure that, but I think we're at maximum, as Bob said now. But it is operating well. Medical services are being provided. Meals are being delivered and distributed. I was met last Friday, by 2 guardsmen in uniform immediately as I pulled up. Making sure, and I just asked them, what's the coordination? What's the logistics? How are things going? They gave a report that, in fact, things are going along nicely. They do have to call for transportation. Appears to be one of the difficult concerns. As we know, transportation on the Cape is difficult. They're teaching them how to use the bus, system. That is being done, but the guardsmen are there during the day. At night, there is a manager on site. They've all been made aware of that, and they're accessing that. If they have to, they're accessing that information. School started a week ago today on the 18th, and I would refer to the school department and what Bob had said as far as the school buses and the picking up and things of that nature. But that students are enrolled from that site, and that seems to be going smooth, very, very smooth as well. Bob mentioned the press releases, but more than anything, there is surveillance going on, and there's medical for the individuals that are there, the safeguards for public health, for the individuals and the families that are living there, and the at-large community for Yarmouth, to making sure that individuals, their health, their safety, and their future, as far as moving hopefully up and beyond this. I handled housing in some big urban communities, and this is really warehousing individuals. It's really not giving them much of an opportunity to thrive. I hope this is just phase 1, but they're on a track to then be able to move up and out, and that's where that is. But we're monitoring this. I hope the community understands. Communicable disease tracking is in place, and there has not been a concern in any way as far as communicable disease.